On the day of the reception featuring past presidents, we'll talk with the president-elect plus 2 candidates for the job of president-elect. Also, the Chicago Symphony Orchestra members were here on the convention floor, and what AACC members found to be their most favorite exhibit. Convention News Television is next.
We're speaking with Mr. Steve Wasserman, the Vice President of Marketing for Technicon Instruments Corporation. And Mr. Wasserman, can you tell us about the new products at the Technicon exhibit this year?
I'll be glad to, but first I should point out that we have booths in 3 areas. One is here in the spot exhibit, booth S22, where we are showing the Technicon RA500, which is a random access chemistry system for physician or group practice offices which can produce results while the patient is still in the office. Technicon Diagnostics has a separate booth, number 847, where we feature Technicon reagents for non-Technicon instruments such as the Astra, Cobas Bio, Gemini, and Hitachi 705. And last, but certainly not least, is the main Technicon booth where our new chemistry and hematology systems are being demonstrated. The RAXT system is being shown for the first time at this year's AACC meeting. Come into the booth for a demonstration to see how easy it is to use the RAXT. The Chem1 capsule chemistry system is designed with new technology, added flexibility, and unmatched simplicity. And for high-volume chemistry testing, the Technicon SRA 2000 will give you increased productivity and the lowest cost of operation. The Technicon H1 system has made quite an impact on the market. The H1 is the only system that can do a CBC plus a 5-part differential. This year, Technicon is showing products for laboratories of all sizes and with varied interests. Come in and see what we have in all 3 Technicon booths.
CNNTV presents the American Association for Clinical Chemistry and the Canadian Society of Clinical Chemists Convention News. Brought to you by Roche Diagnostic Systems, Technicon Instruments Corporation, the DuPont Company, and by Beckman Instruments Incorporated.
Hello again, everyone, and welcome to our 3rd day's coverage of this joint meeting of the American and Canadian clinical chemists here in Chicago, Illinois. Wednesday was extremely hot. Hot and humid was the forecast. Hot and humid it was. However, here in the McCormick Center, it was a cool 72 degrees. Equally cool in the face of his new responsibility is Dr. Robert Habig. He's president-elect of the AACC. The last couple of years, and I assume the next couple of years, will be years of big change for people connected with the clinical chemistry industry. As the new president-elect and the president-to-be, of course, what kinds of things are you doing to work those changes in with this association?
Well, part of what we're doing is kind of right behind us as we talk what we call the spot exhibit for our interest in satellite and physician office testing. We have a task force working on the educational programs that might be needed for people who work in those kind of offices to make sure they're doing a good job and providing good answers for the patients in those doctors' offices. We're interested in another area that's a kind of current topic of public concern, which has to do with use of drugs of abuse in athletics and in the workplace. Our members have a lot of expertise in standardization and in quality assurance to make sure that the measurement of those drugs is done accurately and precisely.
Also, I notice as members walk out, they see the sign that says, "See you in San Francisco in '87. That will be your year, your show. What new things or what can we expect at the San Francisco show?
Well, I'm not sure I can answer that question really well. The instrument exhibit, of course, will continue to have the introduction of new instruments. Manufacturers in this area tend to gear their entire development of a new product so that it's ready to show at our instrument exhibit because it is the largest in the world. But I don't have a good answer to that as a specific question.
Of course, when Dr. Habig becomes president, we'll have a new president-elect. Well, the campaign for that office is going on right now, and we talked with both candidates. Is this like a regular political campaign, no holds barred, or is there some other way that you're going about achieving this goal?
There's a much different way to run for election or office for the AACC. It is not a no-holds-barred kind of thing. You don't have posters and buttons and things like this. It's kind of low-key. And I think what we each have done is to present our platform, where we'd like to see the association go, what our goals for the association growth might be, These have been published in our clinical chemistry news. They will accompany the ballots that are being mailed out in August, and people will vote based on what we have said we'd like to see the association accomplish. I've kind of grown up with this association, and I think I owe it a lot. I think the association has done a lot for me. I've been chairman of the membership committee and helped it grow by getting new members. I've been active in my own local section here in Chicago, and I think that I owe the association some time and effort and what I can do to help make it grow and help increase the communications. I think that most associations, specifically scientific ones, need some public relations. And I think that we as scientists are great at talking to ourselves, but I think we ought to learn to talk to the general public. Most people don't know what clinical chemists do. Most people have never heard of clinical chemists. And I think we do so much to improve the quality of life of people who are ill, people who are hoping to stay healthy, that people ought to know about us. And I'd like to help make that happen.
Basically, you guys have your own businesses to take care of. These positions don't pay, yet you want to become a person who's going to be doing a lot of work over the next couple of years. Why?
Well, Kurt, this is an unusual organization. I think of all the associations in this field, this is one where the members really make the difference. We have a very friendly group. They help each other. You don't find them sitting back having parties. They're out looking at the booths. They're here to work. They work in committees. There's just a lot of camaraderie, and yet you have a lot to gain from it.
Now, what is the, you have certain outlooks for the association. What is your general outlook for the couple of years that you'll be in office?
Well, I think chemistry is where it's at in medicine. We have all the gains that are being made now are either through development of chemistry or they're being understood through chemistry. Look at genetic engineering, the advances in immunology, DNA markers. These things are being understood at the level of chemistry, and our group has the unique aspect that we are those who are trained in chemistry. We are sort of the applications branch of biochemistry, and so I think there's a big future here. Just look at this meeting. We have more exhibitors than ever before. We have more participants than ever before. It's an upgoing market.
What about the kind of campaign that you're going to be running? Is it going to be one of those things with slick gimmicks and brochures and bumper stickers, or what?
Well, I haven't given you any buttons, and I think you're in the heat of the campaign right now.
Okay.
My opponent and I are very good friends. We're good tennis opponents, and I think we're both just out to serve the organization if we can, and we'll do our best to make it thrive.
And we will be back in one moment with one of the candidates running for secretary of the AACC, plus a TV talk show host, almost live on the convention floor.
The process of evolution requires gradual change for the better. That change is crafted by imagination and the design of the right tool for the task, at first primitive, then more advanced. Medical technology advances by the same process, and at Beckman, we embrace the spirit of evolution by design, gradual change for the better. And we invite you to share our view, a new view. Since the beginning, we listened, we responded, we anticipated, we planned, and continue to plan, because at Beckman, we take your view seriously.
Dr. Richard Gadsden is with the University of South Carolina. He hopes to become secretary-elect of the American Association for Clinical Chemistry. We talked with him about why.
This is rather low-key campaigning for the American Association for Clinical Chemistry. One runs on its merit and interests and experience within the organization, and wishing to serve in some capacity.
That was my next question. I know it's a non-paid position. I know you have your own business. And I know it's a position where you have to work fairly hard. Why are you seeking this office?
Well, American Association of Clinical Chemistry represents a profession which is well seated in medicine providing services to patients, to the study of the environment, research, and such. I'm a practicing clinical chemist. I'm also a teacher and researcher, and the membership and having experience within the AACC very broadly, serving on the Board of Trustees, committee memberships, and so forth, I feel that, and having a very well invested and deep interest in the organization, I enjoy working with it. I enjoy the direction in which it's going and would like to be a part of it.
Well, Tuesday's poster session drew the interest of several hundred clinical chemists and students of chemistry. Located at the back of the exhibition hall, it has become an indispensable means of communication between chemists working in different fields. Basically, what is your interest here?
I'm primarily here because we're trying to develop an assay for drug of abuse, and I'm checking to see what other types of tests are available and if there are any of the tests that might correlate to our interests in drug abuse testing.
What have you found so far?
Well, that there are some companies that are working on some that might be of interest, but that there might be an area for us to develop.
Now, when you do find some companies that may be working in the same field, will you call the author of some of these reports, or just make a report to your company about what's happening here?
Primarily, I'll be making reports to the company about what I've seen here, and also I may be contacting them later as well.
Are you a chemist also?
I'm a microbiologist, really, by training.
Well, I guess I'm especially interested in the cyclosporin assays.
Now, have you found anything similar to that? Something that's in that same field, or what?
Well, we do a lot of cyclosporins at our hospital, and so I'm just interested in seeing what other people are doing here.
Okay. Why is it so important to have the information displayed in this fashion?
Because in this way, people have a direct talk with the author about the methodology and new improvement and the method.
Will you take notes here, or pretty much what you've read you can commit to memory?
They do have those printed in some other forms. They can use that. Besides that, they want to ask more specific questions to the author.
You know, DuPont came up with a rather unique way of marketing its product. They have a live TV talk show host and the talk show itself set up right here on the convention floor. I'll tell you what, we'll go right now to Dan Chandler.
Welcome to Dimensions 86. When I say welcome, we really mean welcome, because you are a very big part of today's show.
Mr. Clark, I've looked at your set and it is absolutely beautiful. You obviously have spent a lot of money to really make this appear, and it is indeed looks like a regular TV show TV talk show.
Well, thank you, Kurt. It's very exciting to be here and to have this technique as a way of drawing people to our booth. I wouldn't say it's real expensive, I just would say it's real effective.
Okay. Now, who came up with this idea?
The producer that is running the TV show behind the stage that you see here, the set, his name is Glenn Weisenbaker from Atlanta, and he has thought of this as an idea to help educate people as well as entertain them about concerns and issues in the community as well as DuPont products.
I see it's called Live with Dan Chandler. Is he a professional TV person, or is he a clinical chemist?
He is an actual life, a TV personality, and he has had talk shows in Atlanta, Georgia. So he comes to us with a great deal of skill and experience.
And you've briefed him on some of the important concerns of clinical chemistry.
That's correct. And he's also worked a little bit with the guests so that they'd have a chance to understand each other and some of the issues, because we have a limited time here in order to put on a show, which lasts about 20 minutes.
And we'll be right back with a choice for Best Exhibition. Stay tuned.
Innovation, quality, reliability. A new dimension has arrived. The Dimension Clinical Chemistry System from DuPont. Dimension, a low operating cost workhorse analyzer with random access to 37 resident tests and stat capability. Test costs for Dimension are competitive with comparable systems, and its broad test menu of the most frequently ordered tests means fewer instruments are needed in your laboratory. Automated computer-assisted features mean ease of use. In addition, Dimension has walk-away capability and the throughput to get results quickly. Dimension has the flexibility to meet your laboratory needs. There's the Dimension 380, 380E, and the 760. Yes, a new Dimension has arrived from DuPont. See Dimension 86, live TV talk show from the DuPont exhibits.
Now, before there is another massive meeting like the one that's taking place here in Chicago this week, there, of course, will be several important conferences around the country. One of those will be the Beckman Conference in January.
The Arnold Beckman Conference in Clinical Chemistry will be going into its 10th anniversary edition in January of next year. It is a conference which is designed particularly for relatively small groups moving around the country to interface the activities and interests of the association with those of clinical utilization groups and other groups upon whom there's an impact of our kind of technology.
Where's the Beckman Conference going to be this year?
Next year's January 19th through the 21st conference will be in Newport Beach, California. Of course, the topic of that conference is drugs in the workplace.
I was just talking to Dr. Dabowski, and he talked about the Beckman Conference and that there was a clinical publication that's out right now that has it as its headline, and you are the person who's basically responsible for these publications.
Yes, I am responsible for essentially all of the publications of the American Association for Clinical Chemistry. The Beckman Conference book, or now as it's now going to be a supplement to the journal, is just one of the many publications that the association puts out.
Now, how tough a job is it to get these publications out and to the members on time? Because I was talking yesterday with Mr. Miller, who said that we got a couple of them were hot off the presses, and that members can get them here at this show rather than having to wait to get them in the mail later.
That's correct. Obviously, in a member organization where it's a volunteer effort, it is quite a job to get publications out, but we're very proud of the two that we have hot off the press here. One is on quality assurance, which is obviously a vital part of our profession, and the other is a salary survey, which in a way is also another vital part to convince hospitals that we should be paid adequately.
Now, the Publications Committee is responsible for these, of course, these two new ones, the Clinical Chemistry News, which is out on a daily basis during the convention here. What else?
The Clinical Chemistry News, as well as being here at the convention on a daily basis, is a monthly newsletter which goes out not only to our members but to 25,000 professionals. So we see that as a tremendous public relations effort. Perhaps the thing we're most proud of, other than the books and the CCN, is Clinical Chemistry, which is the scientific journal where we learn about new methods, new technologies, new approaches to our field, and that is unquestionably the most outstanding journal in its field.
You know, with all the unique and diverse displays here in Chicago this week, we thought we'd ask some of the association members to come up with what they thought was the best display. Well, here's what they had to say.
To tell you the truth, I like that Kodak DT60 the best.
Oh, really?
I really did.
What was it about it that really caught your eye?
Because it just had everything together. I mean, just it was a total unit. One other thing that I liked a lot, they've got a little system back there, another company, for doing microscopic on urinalysis, which is, I feel, one of the areas in the hospital that they give to the students or the girl that cleans the floor or something, and you know they just don't do them right. And it's an imaging thing, and it really will be very promising. I think it's good technology.
The most interesting exhibits are the spot exhibits, physicians' offices, tests and instruments. They're really the wave of the future, and I think that's where the field is going into right now. And a lot of the exhibitors have come up with really creative instruments so suitable for physicians' offices. I'm totally amazed.
Mainly I was interested in looking at the DuPont booth and the IL booth because I have one of their instruments on site, and Hybridtech because I am putting their tests online in my laboratory.
What was it about the DuPont booth that you liked?
The dimension, very much. I'm very interested in that.
Seems to be a very popular...
I think it's going to be an excellent piece of equipment.
Actually, I'm here for a poster presentation, and my topic is about rubella. So actually, I'm doing the projects related to infectious disease. So, well, this area would attract my interest. So like Abbott, Beckman, you know, and like Kelstar, those those are the stands actually I take a glance at this morning because I just been here for this morning.
So as you can see, in some cases the gimmicks work, in some cases they didn't work. But clinical chemists as a whole were pretty much interested in their own fields of expertise. Anyway, we will be right back in just a moment. Stay tuned.
Diagnostics in 2386 AD.
What is your problem?
Pain.
Lift your polymer sheet and indicate area of pain. There's a lot of that going around. Enter your social security number, World Health Code, HMO election, your DRG cap, and take your shirt button out of my eye. Hold your breath. I am processing. I have processed. Your diagnosis is acute gastrocolic hypersomatization complicated by ethanol. I will cure you.
Gee, thanks.
Have a nice day.
Well, maybe that's the humorous state of the future. But the state-of-the-art of today's diagnostics is here at Hoffman LaRoche. 7 decades of worldwide effort by this research-driven company have created a world class of excellence. Pharmaceutical products, vitamins and nutritionals, animal health products, fine chemicals, the standards. And today, when technology, change, and cost containment are the watchwords, we find Roche Diagnostic Systems on the leading edge. Instruments, reagents, technical support. Cost-effective systems which continue to lead the way. Come see us at the Roche Diagnostics booth. See the leading edge in cancer detection, CEA Roche, the original and still the standard. The leading edge in drug of abuse screening, AbuScreen. The leading edge in therapeutic drug monitoring, Cobas Bio FP. Then see Cobas Mira, the chemistry analyzer. It is unquestionably at the far leading edge of the industry. And you can win one for your institution just by visiting our booth. Look for this sign.
I am waiting for you.
And finally, Boehringer Mannheim, a class act. And you could call them a classical act as well, because for their exhibition they have several members of the Chicago Symphony Orchestra's string section. They've been playing all through the exhibition week. I've had the opportunity to see some of the Boehringer Mannheim exhibits at other association meetings, and they've all been very tasteful. This time, you guys have really outdone yourselves.
Yeah, we're pretty proud of what we've been able to accomplish here with the use of the Chicago Symphony as a tie between fine instruments and fine instrumentation. And it looks like we've been a success, at least from that point of view. To have the Chicago Symphony is quite an honor, both for us and I hope for the members that are attending.
How has it worked out in terms of attracting people to the booth?
As far as attracting them, it's worked very well. This booth has been very crowded all yesterday morning and in the afternoon, and from the looks of it this morning, once again, people are wanting to take a rest early in the day and relax with us and be comfortable.
I noticed that the folks are sitting down and looking, watching the music, listening to the music, but it seems to be that your salesmen are getting no rest at all.
None at all. It's been very hectic here, and we're enjoying it very much.
Schrobeck, violin, Fred Spector, violin, William Schoen, viola, and Don Mullane on cello, all members of the Chicago Symphony Orchestra. And on that note, a rather classical note, we'll say goodbye. We hope you've enjoyed our newscasts. We've certainly enjoyed bringing them to you, and we hope to see you in San Francisco in 1987. I'm Kurt Anderson of Convention News Television, hoping you have a safe and pleasant trip home.
The American Association for Clinical Chemistry and the Canadian Society of Clinical Chemists Convention News has been brought to you by Roche Diagnostic Systems, Technicon Instruments Corporation, the DuPont Company, and by Beckman Instruments Incorporated. This program was produced by CNNTV.